Hello, how are you? Today I'm going to talk to you about a pill that can increase your body's natural testosterone production without injections and without the risk of infertility. A lot of people have been asking me to make a video about this pill to better understand how it works, who it's for, and what the scientifically proven effects are. You're going to love this video, so stick around until the end. Before we start, I want to ask you if you keep track of your testosterone levels. Have they been increasing or decreasing as you get older? How has that been for you? How old are you? Are you a man or a woman? Because women also need to be concerned about testosterone. Write that for me down here in the comments. I'd love to see your comment. If you can, go ahead and like the video now. That's really important to me because it shows YouTube that you support the channel and trust my content. Let's talk a little more about what testosterone is so you can better understand the importance of this hormone, which is so fundamental to our bodies. In the case of men specifically, it is regulated by the hypothalamus-pituitary-testicle axis. So these three centers in the male body stimulate the production of this hormone, which is so important, essential for libido, muscle strength, bone density, energy, and concentration in men. And with age, a sedentary lifestyle, when men have excess abdominal fat, and sometimes even with sleep deprivation, testosterone levels can start to drop, and the body ends up forgetting to produce this hormone, right? Because it ends up being put on the back burner and is produced less and less by the male body. There are two types of hypogonadism, that is, reduced production of testosterone. There is primary hypogonadism, meaning testicular hypogonadism, which is when the testicle does not respond to the stimuli from those axes I mentioned to you, the ones that come from the brain, right, that come from outside. And there is secondary hypogonadism, which is when the problem is actually in the brain, when there is little hormonal stimulation from LH and FSH. So in this second case, the testicle would be capable of producing testosterone, but it ends up becoming a bit lazier. And that's where this pill that everyone is talking about comes in, which is called Clomophene, or clomophene citrate, which can stimulate your testicle to produce more testosterone. Clomophene functions specifically as a selective modulator of estrogen receptors, so it effectively deceives the man's hypothalamus by systematically blocking these estrogen receptors. The brain then believes that there is little testosterone. It perceives this testosterone differently, increases the production of LH and FSH, and then these hormones go to the testicle and stimulate the testicle to produce more testosterone, more sperm, as if it were waking up the man's testicle to produce more of these hormones that are so important for him. Normally, when doctors are going to prescribe, because all these medications require a medical prescription, okay? Obviously, it affects a very important hormonal axis in men's bodies. So it should be done with prior medical supervision, depending on whether it's necessary or not. I'll talk more about that with you here. But usually there are two types of replacement, right? Usually of hormones. There is the replacement with pure testosterone, which is usually done with exogenous injections, where you directly provide the hormone to the man. In this case, fertility may decrease and there can even be possible atrophy of the man's testicles because you are giving a large hormonal dose to the man. So the body thinks, there's already a lot of hormone here. Why should I produce more hormone? This can have a negative side effect for the man. In the case of clomophene, it stimulates the man's own hormone production by his own testicles, so it can even maintain fertility and preserve testicular volume, which is also important for hormonal health and for the man's overall health. It might sound really wonderful. You might think, wow, doctor, this is fantastic, right? So is this the ideal path to follow? Why don't people talk more about this? Let's talk about this now. It's worth telling you that this medication, when used for this purpose, is off-label, meaning if you look at the clomophene package insert, it's not indicated for this, but it has been used for over 30 years for this purpose, with positive effects for men. So, usually doctors who find that a person has this secondary hypogonadism use clomophene with monitoring over 8 to 12 weeks, right? With short intervals for LH, for FSH, total testosterone, free testosterone, estradiol, and the main sex hormones, all monitored over 8 to 12 weeks, closely together to see how the man's body is responding. And always only in cases of secondary hypogonadism, because if it is used unnecessarily, that is, in men who have damaged testicles or without a real deficiency, it will not bring any benefit to that man and can disrupt this hormonal axis. You saw that it affects the secretion of several important hormones, so this is a very important point. Before your doctor prescribes it, because once again, it has to be prescribed by a doctor, you will need to see an endocrinologist, a urologist, or a doctor who specializes in men's hormonal health. He will first have to do a preliminary analysis of your sex hormones. Is there a deficiency? There is a deficiency. How are your testicles? Are they capable of responding? They are. And then he will determine whether or not it is appropriate to use clomophene. He might find that another treatment method, a more specific medication for your case, is needed. So that's something the doctor will always determine for you. I wanted to bring you this information because there are some men who start to enter andropause and become interested in this issue of hormone replacement, of waking up the testicles, getting them to produce their own hormones again. And this could be one more piece of information for you to discuss with your doctor who is following your case in your city. The dosages can vary, just like with any medication, depending on the individual, on other medicines you take, on the health problems you have or don't have, and on your specific needs. Research shows that doses from 12.5 to 25 milligrams per day can increase testosterone levels by 2 to 3 times after 4 to 6 weeks. So it really is a very significant increase in testosterone levels and can boost energy, improve libido, focus, body composition, in other words, increase muscle mass and decrease fat mass. So this effect is not immediate. As you saw, it takes 4 to 6 weeks, about 1 to 1.5 months, right? So it takes weeks because it is affecting your hormonal axis. And it's also absolutely important that you make other changes to your lifestyle and your diet in order to complement this. And even so, you can maintain these healthy results later on when you finally stop the medication. As I mentioned, it's important that you continue with laboratory monitoring, regular medical checkups, and keep seeing the doctor who prescribed this medication to you. Monitor the response time. For some people, it can take 8 to 12 weeks, and there are people who do not respond to the treatment, okay? The doctor will tell you this as well. And usually, when the doctor discontinues the medication, the hormone levels may drop. So it's important that you are already aware of all this. The doctor will explain all of this to you, depending on whether or not you need to use the medication. Like any medication, it can carry the risk of side effects. Some people report blurred vision, which is often temporary. Some men report headaches and mood changes. It affects hormones, right? So it really can cause all of these things. Nausea, acne, and even breast tenderness, even in men, because it can increase estrogen. In rare cases, thrombosis, gynecomastia, irritability. It's a medication. It affects your hormones, so it's not a joke, and it's not something you should take on your own. It's not like, oh, a friend of mine took it and had good results. Never do that. It can be very dangerous for you. It's also worth reminding everyone that there are factors in your daily routine that can harm your testosterone levels. So, obesity impairs testosterone production because adipose tissue converts testosterone into estrogen through the enzyme aromatase. So, if you are significantly overweight, your testosterone is probably already lower, so trying to lose weight and increase your muscle mass, which also produces more testosterone, will help you in this regard. I have a playlist on how to lose weight and a playlist with everything about testosterone. I'll leave them down below in the description for you. As I mentioned at the beginning of the video, poor sleep and chronic stress increase cortisol, which blocks this hormonal axis. So trying to sleep better and manage your stress also usually helps improve your testosterone levels. Excessive alcohol and a sedentary lifestyle decrease the testicular production of testosterone. So you can see that lifestyle is closely related to improving testosterone as well. A diet low in zinc, magnesium, and healthy fats reduces the raw materials you have for synthesizing this important hormone. So it's important for you to do weight training because weight training increases lean mass, enhances the signaling of this extremely important axis, and that you get very good deep sleep in an ideal amount for you, and that you eat a balanced diet. As I mentioned, I have a playlist talking more about testosterone and men's health. I'll leave all of that down below in the description for you. In fact, I've already prepared some recipes for juices, smoothies, and even gummies that you can consume daily to also help complement and improve your body's natural production of testosterone. Of course, it will never compare to Clomophene, right guys? But I think that when you manage to have a good diet, good sleep, a healthy lifestyle, do weight training, reduce your stress, cut down on alcohol and smoking, all of this together definitely boosts your hormonal axis and your testosterone production. And then if you need to take the medication, it will be even more effective. Tell me if you've ever taken this medication, if you've tried any other hormone replacement, if you're thinking about it right now, and what your results were. I would love to see your comment. Remember to like the video, that's really important to me and for the channel. And share this video with anyone you think will enjoy it or who needs it. Let's work together to expand this chain of kindness. That's what I want here with the channel. See you next time. Bye.